Hello everyone. Today's topic for discussion is glaucoma. Glaucoma, as we all know, is a group of disorder which is characterized by optic neuropathy, which occurs in majority of the patients due to raised intraocular pressure. Now there are two types: angle closure and open angle glaucoma. Angle closure glaucoma is mainly seen in hypermetropic patients, and open angle glaucoma is seen in myopic patients. Now angle closure glaucoma, also known as narrow angle glaucoma, there is basically narrow angle of the anterior chamber which leads to aqueous humor outflow obstruction, and thus there is raised intraocular pressure. Pathogenesis includes there can be pupillary block in which iris pushes against the trabecular meshwork and causes obstruction. It can be due to a plateau iris configuration in which the peripheral iris is placed anteriorly, which blocks the angle, or due to lens thickening, which is seen in the elderly patient. In them, it is called as phacomorphic glaucoma. It can also occur because of secondary causes like tumors or neovascularization. Now, factors which predispose to an acute angle closure glaucomas are a hypermetropic patient. If there is pupillary dilatation, like mydriatic drops are used in a patient, it will precipitate acute angle closure glaucoma. Sorry, lens growth which is associated with age, which we just discussed, known as phacomorphic glaucoma. And there are certain drugs which can precipitate acute glaucoma. Those includes anticholinergics and tricyclic antidepressants. Now, clinical features for acute angle closure glaucoma. It is an ophthalmic emergency. Patient presents to you with severe eye pain, headache, nausea, vomiting. Abdominal pain might also be present in some cases. There is sudden loss of vision. There are halos present around the light. Mid-dilated fixed pupil will be seen, a red eye, and haziness over the cornea because of the corneal edema due to raised IOP. IOP is markedly raised in these patients at over 40 millimeters of mercury at times. Now, chronic angle closure glaucoma presents with gradual loss of vision due to optic nerve damage, intermittent eye pain, blurred vision. Now, symptoms which worse with mydriasis. There is also a classical history which some patients give is that symptoms worsen when they're watching TV in a dark room or they went for a movies to theater. Symptoms of angle closure glaucoma worsen during these conditions. Diagnosis: slit lamp examination. In that you will see narrow anterior chamber. Gonioscopy can be done to confirm angle closure. Tonometry, raised IOP. Optic disc evaluation is done and you will see optic nerve cupping in chronic cases. Management for acute angle closure is medical therapy is first. Medical therapy is targeted to reduce intraocular pressure and relieve the blockage. So for that you give IV acetazolamide, which is a carbonic anhydrase inhibitor. It reduces aqueous production. Then topical beta blockers like timolol can be given. Again, they reduce aqueous production. Topical pilocarpine to cause meiosis, which will open the angle, and hyperosmotic agents like mannitol and glycerol to reduce intraocular pressure can be given. Definitive therapy is laser peripheral iridotomy. In this, hole is created in the iris, which will bypass the pupillary block which is there. Surgical iridectomy is done if the laser is not successful. Then we have chronic angle closure. Medical therapy is same as acute angle closure, and surgical laser iridotomy, trabeculectomy can be done if it is progressive. Complications seen with acute angle closure glaucomas are, complications seen with angle closure glaucomas, acute or chronic both. There may be permanent optic nerve damage which will lead to irreversible blindness, and there is corneal decompensation due to prolonged raised intraocular pressure. Prevention: you have to screen for high risk individuals like elderlies, hypermetropes, if there is a family history, and if there is a patient who has a narrow angle, then early laser iridotomy can be done. Now that's all for angle closure glaucoma. We will be discussing open angle glaucoma in the next video. Thank you so much, and I'll see you in the next video.